All right, guys, this is Caesar with Nursing School Made Easy, and today's topic is Cushing's syndrome. So get your pen and paper ready. This is, again, geared towards nursing students. If you're going to take that NCLEX exam or if you're going to take a final exam, hopefully I can give you some tips to prepare you a little bit better for that exam. Again, pen and paper ready, let's go. Cushing's syndrome is caused by an overproduction, oversecretion of corticosteroids, mainly the glucocorticoids. Remember, there are three types. Number one, the glucocorticoids. These regulate your metabolism. These will increase your blood glucose levels, and the main and primary glucocorticoid that you want to focus on is cortisol. Again, just like I read to you, it will increase your blood glucose levels, so you will want to monitor. You want to do your finger sticks on a regular basis, typically AC and HS, depending on what your physician wants, and you will also have to administer typically more insulin to this patient, but again, this will be based off of what your results are when you do your glucose finger sticks. Okay, so again, you want to monitor your diabetic patients very closely, and the other thing that you want to do is you want to monitor their carbohydrate intake. You definitely don't want to give them cheeseburger, french fries, and a milkshake for breakfast, dinner, whatever the case may be, because those will also cause their sugar levels to rise. Okay, so you want to, one, monitor their sugar levels, and two, monitor their diet. They will typically be maybe on a diabetic diet. Number two, the mineral corticoids. These regulate sodium and potassium balance. The main and primary mineral corticoid that you want to focus on here is aldosterone, which will increase sodium absorption and cause potassium excretion. Remember that sodium and potassium have a inverse relationship. If one goes up, the other one must go down. So if you have increased sodium intake, you must get rid of potassium. Also remember that if you have increased sodium absorption, this will also mean that you will retain water. Water goes wherever sodium goes. So if you have, again, increased amounts of salt in your body, you will retain water, which will mean that the patient will also most likely have weight gain. So you also want to check their extremities for edema. Is there any edema in their lower extremities and their upper extremities? Is there a jugular vein distension? How do their lungs sound? Are there any crackles present? Okay, so again, you want to monitor their daily weight. And the other thing you want to do is you also want to tell these patients to not consume large amounts of sodium, because if they're retaining salt, you definitely do not want to give them more salt products, because again, they will retain more water weight. Okay. Number three, androgens. These will have an effect on male and female sexual characteristics. Androgens are the sex hormones, testosterone and estrogen. In females, you want to watch out for what's called hirsutism. So on your test, you might see something like, which of the following would you see in Cushing's syndrome? Weight gain, insulin resistance, and hirsutism. Well, all those are part of Cushing's. And women, what hirsutism means is increased in facial hair, increased in chest hair, increased hairiness overall. And males, you want to look for what's called gynecomastia, or increased in breast size in men. Again, women is due to increased testosterone production, and males is due to increased estrogen production. Let's move on to causes. The most common cause of excess corticosteroids in the body is due to the administration of exogenous corticosteroids such as prednisone, methylprednisolone, or Solu-Cortef. These steroids have an anti-inflammatory property, or anti-inflammatory property, or two, they also suppress your immune system. Okay, so again, the two properties that these corticosteroids have are, one, anti-inflammatory properties. So people that suffer from rheumatoid arthritis, osteoarthritis, or maybe somebody that just overuses a muscle. If you have overuse of muscle and you just really swollen, really hurts, a physician might prescribe something like prednisone, which is a corticosteroid, to decrease inflammation. The other reason, again, is to suppress the immune system. This is very important in people who have had some type of organ transplant, kidney transplant, liver transplant, heart transplant, pancreas transplant, so on and so forth. It is foreign to the body, so your immune system will attack it. So one way to go around that is to suppress your immune system. So that is why, or that is another reason why you would use these steroids. Number one, anti-inflammatory property. Number two, they suppress your immune system. Other causes of Cushing's may be due to a pituitary tumor or adrenal tumors or carcinomas. Okay, but again, the main reason is an exogenous administration, either PO or in an injection form. Now, a couple of clinical manifestations that you really want to be aware of. Number one, weight gain. We talked about this. When you consume sodium, you will also retain water weight, which will have an increase or will cause you to increase in weight. So you want to monitor these patients. You want to do your daily weight check. Okay. Number two, hyperglycemia. Again, this is due to cortisol-induced insulin resistance. So you will want to monitor your diabetic patients, and even if they're not diabetic, they may become somewhat diabetic because their sugar levels will rise, again, due to this cortisol-induced insulin resistance. Number three, muscle wasting. Cortisol has a catabolic effect on protein and peripheral tissue. Cortisol kind of breaks down tissue, it does. It has a catabolic effect, which means it eats up tissue. This will result in muscle weakness, muscle wasting, loss of protein in your bone matrix. Also, this is very important because it will lead to osteoporosis with long-term use. It will break down bones, so you have to be very, very careful with patients that they don't fall. Okay, if it's an elderly patient and they've been taking large amounts of corticosteroids, you want to make sure that they are on fall precautions, because if they do fall, they will most likely have or suffer from a fracture. The other things that you want to watch out for, other clinical manifestations, mood disturbances, irritability and or depression, tachycardia. We already talked about hirsutism in females and gynecomastia in men. You will also have stretch marks or striae. Again, this is due to the weight gain. Okay. The other thing that you want to watch out for is hypertension. Again, you have increased salt intake or increased salt retention or sodium retention, which will mean increased water retention, which will make your blood pressure go up. Hypokalemia, we talked about this with aldosterone. You have increased sodium retention and increased potassium excretion. So increased potassium excretion will result in hypokalemia. Okay. The other thing is you will watch out for thin, fragile skin. So you want to watch out for easy bruising, thin hair. This is due to the loss of collagen, because we talked about how cortisol has a catabolic effect on protein. So you'll have to watch out for thin skin. You definitely don't, you especially with elderly patients, you want to be careful that you do not bruise or tear their skin. Okay. Diagnostic studies for Cushing's syndrome. Number one will be plasma cortisol levels will be increased. So you want to check for this. And what you will do a 24-hour urine collection for free cortisol. So you will check for cortisol in the urine. Again, it will be a 24-hour exam. So you will tell your patient to collect urine for 24 hours. If they miss, if they forget about it and spill some urine down the toilet,